Our community's recovery from COVID depends on our collective effort to manage the COVID outbreak. We need your help to manage the outbreak by monitoring our positive cases. This will help our government provide timely assistance as needed. What should you do if you test positive for COVID? First, allow the LBJ or the DOH to initiate treatment and monitoring protocols to help us protect you and your loved ones. Second, pursuant to the Governor's Emergency Declaration, you are required to register on Talofa Pass. The government uses the Talofa Pass contact tracing module to track the movement of outbreak across our country, monitor the health status of those in isolation and quarantine, and to manage the volume of positive cases. Once you have created a profile on Talofa Pass, your account will be linked to the monitoring module. A daily email will be sent to you to remind you to do your daily health status check-ins. EOC will contact you or put you on the list to deliver assistance. Together, we can protect as one.
O te whaatalofa atu I tala o te oto mai lau KVCK mo le nei fiafi e momo atu wa amatane ona whaangasolo le whai o tuilona lua o le booster. I se talanoanga lau KVCK mal tumatai Fomaia Elizabeth Lauvao na ia ta uai o le mafuanga le whai o le tuilona lua o le booster. Ono lo ia pe isi au ngafau le COVID-19 from Maleva whaitaitainga o mawai atu le Delta ona so o mai leo le vaenga o le PA tasi au lea fo iwa le vaenga na lua le Omicron wa ta ua o le PA lua ia Malaysia au ngwa ta ua le Delta Cron lea fo iwa ta ape nei I isi atunu.
Pustu mua la yang ava isfu lo tau sanga lo ngai lunga o pustu mua isfu lo tau sanga lo ngai lunga ma wal fo I o lo fo I su enga e fo teni e alu lalo malo se pustu mua por tu no todo le fo la fo tu ai nai po mai fo su enga mai le fo ile FDA ma le CDC fa pe ma la omia le tu lo na fa po le pustu na lua tu lo na fa po le pustu na lua ina ia fesoasoani foi ina ia faamalosi au le tino e moa ia ina ia faintiti atu COVID-19 ono lo tatou aia pea ato si lo tele ale ese itu ainga variant preterminero fe ai tatou ma le Omicron BA1 ia temi e sui mai le variant ia e te tau ana faamalosi au le tino ina ia mafai ona te atu faamai so le booster lo na lua la po le tuilo na fa ia lo fa pea no fa tu aina e anga ba ai le 5 tau sanga lo ngai lunga 5 tau sanga lo ngai lunga ya e le fa pena fa malosi au fo le watu watu e ava no le booster mo tanga te 5 tau sanga lo ngai lunga ai mese ai la to o lo fa pena ai mai tu nga tino lo to mo lunga o le suka o le kanesa manisi tu ai nga fa pena mena o mi ai le tu lo na fa po le booster lo na lua
Na ta awal te mai tai Fomaia Lauvao tangata anga vaa ma o matua fautuaina I whaia le pusa lona lua o la toa silia ma le 5 tau sanga le mātutua mai e ngase tu mau pe o le suka toto maurunga o ngase o fatunga au maisi ngase whaite tangata mai le mawhai o na whaia lo pusa lona lua pe ale whaia mua le tui o le pusa mua e au fiai le tui le nei I la toa 10 tau sanga le mātutua e foi ngase tu mau
o le pusto lona lua foi ele mafai na faia pa le so pusto mua so ele mafai na fai le tuilo na fa pe afa pe le fai le tuilo mtoro po le pusto mua so a fai wa mai o le pusto mua e fa atali le fa vai aso o mi fa masina fa ton fai le pusto lona lua so a fa pe o mo fai le pusto mua e fa masina fa atali ai fa to a fai le pusto lona lua mo ina tau 5 tau sanga ngai lunga ai fa malusia lava le ono 5 tau sanga ono ina tau le wo mo mai tu nga wa mata foi na le mauaritino tulanga I whaapetite e toi whaamai. So leona sifulima aluanga ilunga. Mana o mia na whaile tui lo na wha po le pusto lo na lua.
O le whanatali malo le trade winds na o atu elo KVCK le so le sa whaiei si tuinga e au fie ma le pusta lo na lua. Na ta ua lau vao o na yele taimi e umai le malo se le pusta mua mua o le mafu anga fo ilia e te tawai o na whaia lau pusta lo na lua. O lo whautua ina malo se le tamaitai foma i le atunu a meise lato wanga va i le pusta lo na lua ina yo o atu mo le whaia o ia tuinga.
O le sifo iwa e anga vaa mo le pusta lo na lua. O le sifo lua tau sanga luanga ilunga. A ila tau lo whaapea lo o mawai mai tu ngā tino. E tele mai lo whamata mai. E le fo ini se upule ngana sa moe e whamata la i e tu ai ngā mai. Awa mai loa. Sanga tau o le lava le malo se tino tite e whaamai po le whaapea o le awanga le ta o le immunocompromise. Paenga la nasu lo tau sanga luanga ilunga. E anga vaa mo le tui lo na lua. A mino na wha po le pusto lo na lua. Nasu lo tau sanga luanga ilunga. Tangata ka tau au immunocompromise runga de la malo se tino e mo wai le malo se te e fa mai COVID-19.
O se tasi le neu fasoswani le tau mate lo talitari e la tolo o ngā e business e tō maoti na fia tupe maua mafo mai na ua whaititia I tū la whaingaruenga o no tapo lo COVID.
Tele o tangata o no anga vaa le Neipo Kalama le Cash Assistance Program o nei tangata whaingaruenga I le tū leo business e tō maoti lea sa whaititia la tō I tū la ia ma sa tapunia ia nei business I le vaitau na tapunia I le atunu po le malo I teimi o le COVID.
Na ta ua te maitai whaatonu ia pulo o lai malo le wha moe le nei o le malo o se wha mama avenga nei o tātou tangata mo wai se fisoswani se leni mo le tausi o whanau maainga ai mai se toi wha o lai tupena le maua I teimi lo COVID malo o ngā lunua nei lana matanga ruenga mo le tu whatasi o pepa o talasanga mo I la tau e anga vaa.
O loo fofuaina le mātou ofisa e amatalia le mātou intake process po o le aso leo le amatalia I o na whaia ia application sa tangata whaingaluenga ia sa awhia lato ngaluenga. Ia o loo ngā lulue whale mātou ofisa wa umawhu ina whaata o se lato plan po se fofuanga fo I vai aso e valu ia mo waile lua se lau wha se fulu. Ia e fua lava I lunga tangata whaingaluenga a wai e isi business I watoi pe o le tūleo le star case watoi amatalia ngaluenga mai le vai aso lona tolu o le Code Red Declaration. Lea la e fua lava I lunga o le mātou plan lea ua whai ele intake. A whapea e nā a fia lo ngaluenga po o I tū la whai ngaluenga I le vai aso mua lua ma le tolu ia o loo iai e po kalama uma whatu langan mata officer e mawailau siaki limited to those weeks nga malolo ai I le teimi o le emergency ia ai o loo iai fo isi fufuanga I tu atu mo nai pisnisi lea lea a fia lava teimi I tu la ia lato I tu la whaingaluenga ona o le emergency declaration ia pe o nai pisnisi e ei fale o noa ia wa e tapuni a vave I o whaititi ai fo I tu la whaingaluenga tangata whaingaluenga ia o loo ngā lulu e le mātou ofisa ia ai inga ia e vava ai e lātou ma determine ai fo I pole ale umi o le benefiti leo le a maua le tangata whaingaluenga.
O le vaitau mai a Februari 2022 o ia Aprila 2020 o le teimini o la toi tutongi atu le tangata whaingaluenga mai lua se lau fast food le vai aso le tupa le tangata le amaua ma le a whaia se whaalau ilo le nei polokalame lunga o penga te whailangi e tu whaatasia le matanga luenga ai mo I la tau e leini masini ma metutia whaanei ona poe whai e talasanga e ma whailawana e talasanga ane le matanga luenga vai e tangata whaingaluenga le malo mo nisi whaamtalanga. Ma matane ona tui matai ali mata mai tai leo ia piki apu o toi lifi maolunga o ta vale we mo li fa popo ele tu sai ma le tu la fono fa pe ta vale o tawa una elea ma le manino lai se ta vale e se tara noanga le KVCK ma sui komisina leo ia Terry le tuli na ia ta wai fa pe o le popo le ngole telo piki apu le o va ai lunga le awala tele o mawa lunga atu ma le lima se furulua inisi o le pito i lalo le ta vale ma le awala tele o nisi o piki apu o peo ni loli la uta o leisi tūlanga le a maitawina leita avale ia o lo iei mori i wha popo lea watau au ina le popula isi avata avale lunga le awala tele pe a wha mumu tele a o whewa i lea tunu.
O kerenga waka avale wa Wa ia I lunga la wala wa si I lunga ia mo lunga ka vale. Ia fa pe ma mori wa popo I ka vale. Ia ko malai sengi o ka vale, o ka uri lo ki le sengi. Na la fa pe. Mato pola sanga I lunga mo sile fio la tnu. Ola makanga fa ma la fa ma sia leo ia kula fungi. Ka lo le kele nga wa ka vale le I lunga la wala. Olo so kula fungi kula ngala le mo lunga mo di. E malai sengi o ka uri lo ak. Ala fa pe. La makanga ka fe leo ia ka vale mo kemi. E wona lai ma ko ia mfa ko kuai. A makaro ia me mua. A makalo lang issue citations leo. La fa malo sia fo ela official OMB. I fa ingo inspection o ka vale. E kusa I mare angar kula fongo. A mai olo uska ia kula fongo le. En fa ya official OMB nga a veces pepe pero el calmo con su vaso. A kula vengo yo ko fa sa bela fa le kongo o ka vale. Kula ngo mori o ka vale nga a mai le factory. O mori ala nga ku le factory ka vale. Ngal pa nga mori fa ka ngai nga. A o si mori lo fa pi ai. E le ma fa nga ka dia ma ko. E ku sala ka wanga ese mori nga e fa sang fa popo mori ka vale ese mai mori nga mai ile factory a o ku langa lao o morunga ka vale. E kaunga lima su dua ingisi mai lalo la wala. E kau dunga piko I lalo le o headlights o mori o ka vale. A lai sege. O la sege kawanga I loa mai lai sege e maru al malo ya kusa mala akongu foi. A fa pengi lai sege wa makafi. Ka wele ele o le lei pai go lai sege. E whaianga mai ai sui ako le official o via lai sege. Ai le kokogia se bea.
E se mai lea, alo mai tawina fo I teimi umai lungo le awale tele, le telo ta avale o tawa na matafi lai sene ta avale, ma ua fautua ina le kusui komisina I latou, e o atu e sui e au no mo se tutongi, wa a mai ala teimi whaatapula awa to ina mai, ai le whaia, le amatalo na to e tutongi ia lai sene.
La fai citations, ele ngaka lai mori, ia a kofo male, ele peko e pa lai sengia ka avale se longa e whaasau sao, lango wingala, o la isu fo ile citation o le fero ai lungo la wala le sengia ka vale e penga ka pilo como singar ka vale ai koso mai ko ka pe va ya kwade la penga como singar o lo fero ya ka el fero ka vale lungo la wala ai lo fa ya bela mo ka pa sa ala male kula po
E pena ta ua le toli o so se ta avale le aleus ta ia le whaatanunga pe a mai ala taimi o tu ina mai e whai ai suinga ai le whaia o le a whaasala loa o le sala tupe le vāo lima se lau ma le tasi le a whetala mai ono se i le laisene e le ma whai ona tu e whaatanga lea ta avale I lungo le awal tele.
O le aso lulu le vai aso fou, le ufofu e amatalia whainga malanga I le vāo Samoa I lua, le au le a amata I le lua malanga I le vai aso. I se reporti na whailo mai lau televise, o lo ta wai, wa mai anei o na wha mautu ai ai ngol malanga mai Amerika Samoa, wha apea mai malanga mai apia, ma o le a tu inatu I lo official Samoa ea, e tutongi ai pase su tangata uma e fia malanga. E iai inga wa malili iai Samoa I lua e tu sai mo nei malanga, ma o le a whailo mai se taimi ile utoi mamao. Ona ole whenga iai o le atunu uma le whaingata o le lea I uniforma I whaapitoa. Mo tonga fitinga whaapitoa e pei o le ivitu po le spinal cord. Ai mai se le maia alio po utua o le ua. O le mafuanga lea o le ai o se tō whamamao I le kalesio au pa ia waso I ngātai. Ono le loto fia fisosoani ma le fia soso tau au whaatasi. Ma le mau tonga singasi o le LPJ. O le lifo mai a James Gabbard o se tasi o fo mai whaapitoa. E iai leanga waa ma le to mai mo tonga fitinga whaapitoa. Ua safari nei le tolu vaiaso talu ona tanu mai le lifo mai a James malona whaletua I Amerika Samoa. Ona ole loto fia fisosoani tangata o le atunuu. E to olua lifo mai le kalisio au pa ia waso ngātai o lo ngā lulu e le mau tangasi le teminei. O le li ia Gabbard me le lifo mai ia Robert Geddington. O lo ngā lue I le ER I le teminei mo le tautua ino tangata o le atunuu. Sa whawhatai e le sui whaatonu o le mau tangasi o le LPJ ia mwe whawo Bill Emsley le lifo mai o Gabbard e mai se le e kalisio au pa ia waso ngātai ono le nganga fisosoani mo le atunuu.
Fia mo le atu se whawhatai wha le lava. I le pa ia o le mamalu le ekalesia ua ona o le latu fesoasoani tele mai i le tauwhainga. E moni o nai fo mai o mai asiasi mai lunga o prokalame. O se prokalame le tu mau. O le autu o le wha moe moe o le whale mai po le maota ngase i nei. Ia fausia ni prokalame wha penei a ia tu mau. O te langona i le tu na mau i luma. O na maua le on tatu fesoasoani wha pitoa. Mo fo mai wha pitoa i ngase o la tonu. E leo mawhaina mau i le teimi nei ki tonu maota ngase. Te leo i lātou, e awatua o lātou ngase i whafo. Ai a o le tūlanga i le mwhai o na la asia le tūlanga o na taunta pāsese ma tūlanga o mea whapena ia na leile o se mea tangi e la tunu. Lea la uwe sosoani mai fo i le e kālesia i le eitu. Ai wha mafa tupe le bātou ngauta ngase. Le o le prokalame o le fesoasoani tau ina soso o ai le tau mwhainga ai leo se prokalame tu mau lea o le wha moe o le ngauta ngase i nei ia fausien to inga prokalame mo whau mai wha pitoa o le sunga la ia ke bata ia o le wha pitoa le i tua ane le wha sausanga la tunu po le mai a lio ai ei nisi o tau e o la ngona le ti ngā le tino ai mai se tua ia vidi mai le ofisa fai se to appointment ba ai le sunga le fo mai.
Pei ona ta ua le sui whaatonu ia mwe whawo Bill Emsley e whaapea o le vai aso fo le atau no mai ai seisi fo i fo mai tamaitai ia Dr. Tar mai le aupa ia o aso ngatai e fesosoani le vai ngol o le OPGYN. Usi mai ala mai moa i tala mai e pia. E pei ona nofo manino le atu no u le tūlanga u iaisa moa i le teminei. I le lea i o seisi e whaamonia ua maua i au ngal COVID mai a polima mamanono tai. E o mai le tau nei ua to o lima tangata fo ua whaamaunia ua maua i au ngal COVID manono tai. I se whaamtalanga le minister le sui fua maloloina. E whaase lau varu se fulu lima tangata fo ua a fia mai le atu no u lau tele i Samoa talu ona pipisi tua le whaama i le atu no u i le masina ua tea. I le ono afe fitu se lau tolu se fulutasi i lau whai o tangata ua a fia i le COVID. E ono afe lua se lau malatasi tangata ua a fia i upolu e lima se lau lua se fulu lima tangata ua a fia i savai ma le to lima o tangata fo ua whaamaunia ua maua i au ngal COVID manono tai. Ma e o mai le tau nei ua sfulu ono tangata o lo ono nofo aia i le mau tangase e to tolu o lo tau fia i le ICU i le taimi nei. O se reporti mai le soifua maloloina, o whainu mero suenga ua mai ona whaia talu ona pipisi tua le whaama i le atunuu, ua lima se fulutasi afe, lima se lau wha se fuluono.
Patala fatu i tātou talama le Pasifika. Wa tauwhia nei le minister le soifua malarone ne Solomona ne potopotonga e siri atu nei lo se fulu tangata iai. Ina ia whaawa waipea pui ngole atu no mai le COVID-19. E whea tonu le leile nei whaamatalanga ma le saunoanga le minister le soifua malarone ia Colwick. Whapea wa saunia atu nei le atu no honi iawa le pipisi whaalua le whaama i le atu no. Masaya whaeloa o tangata umalo o iei fuafuanga mo le whai o whaapoiponga ma saudi ngā lotu. E te taura ngā lulu e whaatasi ma le ofisa o whaarara tutupu whaafusei ina e toi tolopo ia fuafuanga. Sa ia taua fo i so se tangata o fia malanga ese atu, pe malanga mai fo i mai tutonu o niaranga i atu isi vaengo le atu no u. E te taura toi tolopo ia fuafuanga sa ia isi taimi o iluma.
Tala tau mo Amerika Samoa. Pōnā nei mo le asfareile e mā tele na woa e te olu timunga, mā lue fitu, bevele valu fitu, sa vili angi lautasi e o se fulu maila li tu la. Po asfareile e o le pōla sa e mā tele na woa e te ape solo timu, mā lue fitu se fulu, bevele valu se fulu, sa vili angi lautasi e o se fulu maila li tu la. Atunga fuae o la solulu e mā tele na woa e te olu timunga, bevele valu se fulu, mā lue fitu se fulu, sa vili angi lautasi o se fulu maila le itu la. O le tala na o le tau mo Amerika Samoa mo le afiafi nei. Tue mawatu sesi o na whapoponga i le aso atai au. Manu e telefofuanga ne afiafi, soi fuaia.
Our community's recovery from COVID depends on our collective effort to manage the COVID outbreak. We need your help to manage the outbreak by monitoring our positive cases. This will help our government provide timely assistance as needed. What should you do if you test positive for COVID? First, allow the LBJ or the DOH to initiate treatment and monitoring protocols to help us protect you and your loved ones. Second, pursuant to the Governor's Emergency Declaration, you are required to register on Talofa Pass. The government uses the Talofa Pass contact tracing module to track the movement of outbreak across our country, monitor the health status of those in isolation and quarantine, and to manage the volume of positive cases. Once you have created a profile on Talofa Pass, your account will be linked to the monitoring module. A daily email will be sent to you to remind you to do your daily health status check-ins. EOC will contact you or put you on the list to deliver assistance. Together, we can protect as one.
Talofa, you're watching this quick update from KVCK News. Thanks for joining us. The general rollout of a second booster vaccine against COVID-19 to people aged 50 and above has begun. The rollout of a second booster to people aged 12 and over with weakened immune systems has also begun. According to Dr. Elizabeth Lauvao, this second booster shots are for those most at risk of severe illnesses from COVID-19, and it is important you get your second booster to help maintain your protection from becoming seriously ill or needing hospital treatment if you catch the virus.
The second booster is especially for those who are 65 years and older and those who are labeled as immunocompromised. So those with HIV infection, with cancer, and those are taking higher doses of corticosteroids. So those are the people that need a second booster dose. But that doesn't mean the other population or the other age group that cannot get the second booster dose. So in order for you to get the second booster, you have to have your first booster. So for if your first booster, if it's Pfizer or Moderna, you have to wait 4 months after your first booster to get your second booster.
Dr. Laval says the provision of second boosters to older people and the immunocompromised follows a recommendation from the CDC.
For those who are qualified or those who are for the second booster are the 50 years and older, and especially for those with comorbidities. You know, like in American Samoa, there's a lot of people with diabetes, hypertension, obesity, and those are the people that are recommended they should get the booster, the second booster, the 50 years and older, and especially the 65 years and older, because their immune systems kind of went off and they need protection against COVID-19. And also, those who are qualified for the second booster are age 12 years and older, but labeled as those who have immunocompromised. So they are strongly advised to get booster number 2.
As the COVID-19 pandemic lingers on and as researchers keep an eye on a rise in cases driven by new mutation of the Omicron variant, Dr. Laval says it's time for some people in our territory to once again booster up. The CDC, or the U.S. Centers for Disease Control and Prevention, and the FDA have approved a new round of COVID-19 vaccine boosters for certain members of the population, those over 50 years of age and individuals 12 years of age or older. These groups, according to Laval, are most at risk of serious complications from COVID-19 infection. They are at higher risks of severe disease, hospitalization, needing a ventilator or ICU for their care, and even potentially death. They are also the groups of our population whose immune response may not be as robust. These additional doses are helpful for vulnerable groups as their immunity from previous doses wanes over time. Department of Human Resources will soon roll out the Cash Assistance Program, or CAP, for workers whose employment was affected due to COVID-19 restrictions. According to Director of Human Resources Len Puloa Malo, the CAP targets the private sector workforce as many businesses were shut down under the COVID-19 emergency declaration on February 22nd, when the community's spread of the deadly virus was first reported in the territory.
So during the Code Red declaration, it was informed that small businesses were greatly impacted because their hours were minimized, and plus a lot of stores and businesses closed down earlier than the normal times and the normal hours. So with the impacted workers, we were able to put together a plan and a proposal for the governor to aid during the time of this minimal hours that they had for the employees. I know that with this cash assistance program, it has been targeting over 2,500 employees in the private sectors. At the same time, the government operations, even during the Code Red, the operations were still ongoing for the government, but on the private sector side, a lot of hours were minimized for workers. The stores and small businesses closed down, so the cash assistance program has really come in during such a transitional time for employees in the private sector.
Director Puloa Malo says the measures and procedures in administering the CAP program will be overseen by DHR's Division of Pandemic and Employment Assistance, or PUA, the local administrator of the federally funded program. Puloa Malo's proposal given to the Executive Director of ABA, Kvzktv, says many employed residents have been impacted by the restrictions under the COVID-19 declarations. Asked when and how people can register, Puloa Malo said that an online virtual public forum is scheduled for April 28th, with intake applications to begin on May 2nd.
We've determined the rate, which is going to be $240 weekly. And then with our proposal, we based it on 8 weeks of this program. So we're subject to end this program and the intake process probably around June. We'll be rolling out our plan and intake on and our outreach on May 2nd. Tomorrow will be our interview. And we're basically sending out flyers and informing the public of the dates and the time and the hours. We also have Zoom links that we've shared on our social media sites and the websites to inform the public of the important times and the hours and when this division of ours is going to be rolling out their plan and kicking off in the coming days.
Under the CAP program, qualified workers who were impacted by the Code Red restrictions between February 22nd and April 18 will receive up to $240 per week. Those eligible for the program are applicants who experienced pay cuts or furloughs from the private sector employment, and this includes workers who were unemployed or underemployed, who experienced a loss of income, and who experienced a reduction in working hours from February 22nd to April 18 due to the Code Red restrictions. Police say they're cracking down on trucks with additional blaring lights, trucks that are illegally lifted, and vehicles with fading number plates. According to Deputy Commissioner Terry Letuli, this is a safety issue, adding police will be citing operators of vehicles that fall outside the law's parameters.
We are observing a large amount of numbers of vehicles that are on the road that have been lifted, which is now higher than the regulated height of vehicles, and additional lights. These lights are the lights that has been put on by the owner. This includes fog lights, blinking lights, emergency lights, and also other lights that you put on top of the vehicle. Those lights are considered unlawful within our laws. And also the license plates. The license plates should be visible within like 50 to 100 feet. Some of the licenses have been, it's a fault of the government or the department, because of the license were from a good vendor, and the painting on the numberings are faded. So those licenses are, since it's a fault of our department, of the ordering of the vehicle license, we will replace the license for free. You do not have to pay $30 for a new license plate.
The intent of the law is to minimize the splashing of mud, rocks and harmful debris onto the path of other cars. Such splashing can cause damage and visibility problems for other motorists. Throwing rocks and other debris off the road onto people's windshields presents a danger on the road. Basically, when you start lifting your vehicle up, you open up your tires to all the rocks and road grime and whatnot, he said. You get rain and mud and all that jazz, and the tires are picking it up and slinging them. Latuli said not only these cars are too high for our roads, but also he notes that some have added more bright glaring lights that can cause accidents on the roads. While lifted vehicles aren't inherently illegal, some drivers have their vehicles lifted beyond legal limits for the gross vehicle weight, as measured from the ground level surface to the largest point on the bottom of the bumper.
The height of the vehicle should be 52 inches from the road up to the bottom part of the headlamps. Should be 52 inches from the ground. And our inspection office at the OMV, they will be doing their inspections. If you do not adhere to the proper regulations or the law, they will issue you a 30-day temporary license where you can take your vehicle back and try to correct the height of the vehicles or the removal of the lights and also the license plate. So we'll give you a 30-day a temporary license where you can do all those changes before you bring it back. But if you do not adhere to the 30-day temporary license, your vehicle will not be registered.
According to Deputy Commissioner Latuli, the maximum allowable height is 52 inches from the surface of the road, and drivers can be fined from $500 to $1,000. Latuli said a police officer also has the authority to declare the vehicle unsafe. In that case, the vehicle could be towed away and citations will be issued on the spot. Once you lift your vehicle, your center of gravity is changed, according to Latuli. Also, the stability of the vehicle is affected. He said reasons many drivers have their trucks lifted are purely cosmetic.
Samoa Airlines will resume regular flights between Apia and Pago starting next week on Wednesday, April 27. A report received by KVCK from the Governor's office says the Samoa's government and the task force have agreed to resume flights between two Samoa next week, commencing with 2 flights per week. Locals who are in Apia will be able to travel back to the territory on next week's flight and other flights scheduled for the following weeks. There are conditions of travel through, but that information is forthcoming according to Governor staffer KVCK TV spoke to. More blessing continued to pour into LBJ's operation with the arrival of surgeon specialist Mr. James Gebhardt. Mr. Gebhardt is here as part of the Church of Latter-day Saints, and he will be working mostly in surgical ward at the LBJ hospital.
Dr. Robert Caddington is the emergency room doctor who is in the emergency room right now, almost completing his 18-month mission in July. And with us here today is Dr. James Gebhardt, the orthopedic spinal surgeon, who will be with us for the next 18 months. And we have already planned and prepared procedures that will be done in this hospital through spinal surgeries, spinal injections that has never been done before on this island. This program does not cost the hospital anything. It is a free mission that is provided by the church to help us and assist us in our times of need. We will be having also future missions that will be coming to this church at the end of this month. Next week, we will be having an obstetrician and gynecologist who will also be doing interventional surgeries and services that has never been done before on this island. And later on, in the later half of this year, we'll be having a cardiologist who will also be coming down for 18 months to provide the services that has never done before. These are the services that allows our people to travel off island to be given this service either in Hawaii or in the United States. Through this mission, we will be able to do these services down here, treatment and surgery down here that is never done before, and the reason for referring our patients of Highland.
Dr. Landu says the arrival of Keppard and other specialists is a huge relief for the hospital, and the LBJ is deeply grateful as a medical center and as a community to the LDS Church, the defense, especially doctors who have traveled from across the country, leaving their families behind to provide vital support to LBJ. The arrival is an incredible morale boost to our staff, and we look forward to welcoming them as member of the LBJ family and thank them for their service and sacrifice, says Dr. Landua. One of the two small islands in Samoa which had been COVID-19 free so far now has 5 community cases. The Ministry of Health confirmed the cases on Manonotai in its latest report, which also said there were 485 new community cases around Samoa with no fatalities. The ministry said this brings the total number of community cases recorded since the outbreak began last month to 6,731. There have been 6,201 cases reported in Upolu, 525 cases in Savaii, and now 5 in Manonotai. The release also said there are 16 cases in managed isolation and 3 critical cases in ICU. The ministry also reported that the number of rapid antigen tests administered since the community outbreak is 51,546.
The Solomon Islands Ministry of Health has put a stop to gatherings of more than 10 people as it continues to fight against COVID-19. This comes as the Minister of Health, Kolwik Tongamana, said the capital Honiara was facing a second wave of coronavirus. He has announced people planning for weddings and church services need to work with the National Health Emergency Operations Centre. Dr. Tongamana said once all infection, prevention and control measures are in place, the centre may issue approval to proceed. He also urged those wanting to travel to and from Honiara to defer their travel plans unless it was necessary to do so.
This is the weather forecast for American Samoa. Tonight and Friday, mostly cloudy, numerous showers, lows around 77, highs around 87, variable winds up to 10 miles per hour. Friday night through Sunday night, mostly cloudy, scattered showers, lows in the upper 70s, highs in the upper 80s, variable winds up to 10 miles per hour. Monday through Wednesday, mostly cloudy, numerous showers, highs in the upper 80s, lows in the upper 70s, variable winds up to 10 miles per hour. And that's the weather for American Samoa. Another update tomorrow. Have a pleasant evening and good night.